Okay, thank you. Another question I have, and I'll let other people ask questions if they have, but so I know people that often will say, well, I'm in the medical field and I want to go help in Indian country. Um, and, they want to do stuff. Is there anything that they can really do as far as mission trips? Do you know of any avenues for them to help?
That's a really good question. Um, and it's something that I don't think Indian Health Service has really thought about very well. I would encourage them to think about a long-term mission trip, like working in Indian healthcare for, 2 or 3 to 5 years somewhere in that neighborhood. Like a minimum of two, but I shouldn't say a maximum, but a minimum of 2 years, but probably in the 2 to 5 year range, and just consider living in a rural community or in an urban Indian community, and working at a healthcare center in that kind of way. It would be a smart idea, I think, for Indian Health Service to think in terms of let's do mission trips to areas that are underserved in their healthcare. I'm
Yeah.
thinking of that community, Bridger, South Dakota, something like that. But then the problem is, then it also has the stigma of, Indians start turning into this third world country, or people, and the reality is a lot of the issues of poverty and health and life are third world conditions, but people don't want to say that about an area.
Mm-hmm. I was just thinking in particular, there was a doctor that reached out that was talking about the low birth rate amongst Native American women. And
We actually have a really high birth rate.
oh, really?
Mm-hmm.
There's something
Our birth
about
rate is crazy high.
I know. In South Dakota, actually, on the Pine Ridge Indian Reservation, they estimate that half of our population is under the age of 18 right now. So it was like, yeah, we got a big group of kids coming up soon. Anybody else have any questions out there? Nick or Byron or Melissa?
I do.
Sure, go ahead. And can you tell us a little bit about yourself?
Hi everyone. My name is Byron Sloan. I am a Navajo. I currently I work for the Episcopal campus ministry at the University of Arizona. And I'm also getting involved with the indigenous group here in Arizona through Reverend Royal. I'm a student at the U of A too. My question is if there are any other programs that are aimed at Native American wellness, in terms of what is going on right now in Navajo land, how they're building hogans around the reservation, and if there are any results of those efforts in Indian country.
I'm sorry, I'm trying to understand your question. You're asking about Navajo land and the Hogans and what? Oh, I think we lost Isaiah?
No, I'm here.
Oh, okay.
I'm here. I just thought that question was addressed to you. I don't know much about. I know a lot of tribes are incorporating spiritual health into the healthcare they provide. Most tribes will contract with a spiritual leader to do elements of healing from that perspective. So they usually have like a medicine person they contract with, and several of the healthcare centers in the tribes that we serve have like actual spirit houses, like hogans, but they call them something else. I think they call them lodges, where they can do stuff. Like they have sweat lodges and regular, I don't know how to explain it. It's like a large structure that they hold spiritual ceremonies in. It's not a teepee. It's like a glorified wigwam or something.
Mm-hmm. Byron? We may have lost him.
Or his mute was on.
Go ahead, Byron.
Yep.
He might have bad reception. There was another question that I had related to healing and spirituality, is that I know that as far as counseling services, I saw on your list that the one-on-one rate wasn't as great as far as impact. And I was wondering if that has to do with the levels of confidentiality or the perceived levels of confidentiality. I just know from people that I speak with that they often talk about how they don't want to go to this certain person because then everyone will know they're in counseling, and there's a stigma attached. And
okay. Well, that's not referring to counseling. That would be considered a totally different type thing. That would be called psychotherapy. But yeah, the one-on-one is like in terms of how am I presenting information to you? Like if I'm doing one-on-one education to you, Sarah, like you come in and you're pre-diabetic and I say, well, Sarah, you need to eat this and that and do this and do that. That's the least impactful compared to if, like, let's say all through elementary school, middle and high school, you received that information from your teachers and it was incorporated into the food that you ate at school. And it was like, you see the difference between the one-on-one isn't referring to counseling at all.
Oh, okay.
But that's a common fear that people have is the confidentiality. And that's a problem in small communities, because what happens in a small community when you have, you know, where I go, the person who would check me in at the healthcare center is related to one of my coworkers, and the doctor that I see lives just down the block from me, and like it's all kind of, it gets all kind of messy real quick. But from my experience, I've never had anybody break my confidentiality, and part of, I feel like my job is to also sort of help to break down the stereotypes. Like I purposely go in there and get tested for HIV every year. And even though I could get tested anonymously somewhere else, but I go there as part of just to kind of help break down those stereotypes.
Mm-hmm. Thanks. Melissa, Nick, questions? Byron, if you're still there.
No, I don't have any questions right now.
Thanks, Melissa.
Sure, you're welcome.
And for me, again, Nick Barton, Shenandoah Tribes, Clinton, Oklahoma. I actually got to meet Isaiah at the IHS conference in Minnesota, a few years ago.
Oh, great.
And so everything he's speaking of is, I'm in the field anyways, director of health. So I oversee 4 contract programs and 2 grants, and kind of sit on the Intertribal Health Board here in Oklahoma. So everything he's saying, I'm just sitting here nodding and agreeing. And there's a lot of issues that need to be brought up. How do we tackle them, especially at the tribal level? And tribes working in partnership with Indian Health Service. And for me now, coming back into the Episcopal Church, how do we do this at the church level and this whole other hierarchy? So this is news to me. And so Isaiah, you did an outstanding job. And, I know there's a newer slide because I've seen it from Dr. Rubidoux about the amounts that are paid per sector, but Indian Health is still one of the lowest ones.
Thank you. I think one of the questions I think we need to ask ourselves is, how do we incorporate, or what is the church's role in increasing the health of its communities, and which would include Indian country, and what does that look like? And is that things like making sure we serve healthier food at our feasts and things? Is it things like making sure that we maybe use our community membership or church membership to advocate for different things locally? Is it, what is it and how does it look? And I think the government isn't always so good at working with faith-based organizations, but they're getting a little better at it. And sometimes, they pick the wrong organizations to work with. And we end up with things like, abortion bans or whatever. Or sometimes they pick I'm sorry, maybe your opinion is different than mine. And other times they pick a much better organization to work with. And, we end up with great things, like collaborations between, there was an intervention in Chicago where the HIV rate is very high among Black folks. And what they did is one Sunday, all of the pastors in each of the big Black churches, there was a nurse that came in and tested them for HIV in the church in the middle of the service on the, I don't want to call it the stage, whatever that thing is called. That's where it happened.
The altar.
And that helped to reduce the stigma of getting tested. And then they had those nurses and folks stay behind so community members could get tested in church. And that was like one example of how you could partner to change things.
That's a great point, Isaiah. I know that I was reading through your report from one of the reports from the Standing Commission on Health, talking about blood donation as well. And I remember one of my churches that I attended in Florida, in Pensacola, Florida, used to have a blood drive on site. So certain Sundays there was a blood drive and a blood mobile there for members to go and get tested. So I think any way that we can interact with helping out in testing and what have you will be great. And that's amazing, the story about testing for HIV/AIDS. I think that's great.
Well,
any other comments? Go ahead. We have about 5 minutes and then we're going to wrap it up. Isaiah, any closing words?
I have two.
Okay.
Well, more than 2 words, but 2 closing things. One is, I think, keep the idea of, you talk about bringing the Bible to the church. People sometimes like to say that we don't evangelize, but being active in your community and doing things that benefit your community, that's evangelism. It's a form of evangelism, and I think it's probably the most powerful form of evangelism that we have, in terms of the impact it makes on other people. Because if I tell you you're sinning and then after you're done my church, that's probably the least impactful. And I maybe need to do this chart for evangelism. And then the most impactful is probably being your friend or being nice to you or helping you in some way, basically being the Jesus in your life, if that makes sense, but in a practical way, tangible way, and then you would change. I want to share my screen for a second with my last slide. And I don't know how old any of you are. Some of you I know are older than others, but this slide is about your vocation. And I like it because when you think about what you want to do, and I still am debating about lots of stuff, but where what you love, what the world needs, what the world will pay for, and what you do well, where all that meets, that's your vocation. And that's the little heart there where bliss is. And then in between those different things, you have your passion, your vocation, charity, career, contentment, comfort, satisfaction, and fulfillment. So think about that as you move forward and discern what you're called to do in your life, or I guess what we're all called to do in our life.
Thank you, Isaiah. That's a really great point. And I also want to remind people that are also, as Episcopalians, part of our Baptismal Covenant calls us to strive for justice and peace. And so that's a huge part of our identity, is being out there in our communities and helping wherever we are called to be with our vocation. So thank you again, Isaiah, for joining us. I hope to see more people on later, and we're also going to be sending this video to YouTube. So thank you guys, and have a great evening. Bye.
Bye.